Cardiovascular disease is the leading cause of death in Western societies, and atherosclerosis is the major related problem. Evidence indicates that atherosclerosis begins in childhood with the accumulation of lipids in the arteries to form fatty streaks. Unfortunately, the prevalence of subclinical atherosclerosis is increasing in all ages. These include children and adolescents, as also atherosclerosis and the cardiovascular events do. Using validated tools for non-invasive measurement of subclinical atherosclerosis, such as the total carotid plaque area, has the potential to change the paradigm for evaluation and treatment of elevated cardiovascular risk in people by focusing on target organ damage. Vascularis makes use of new strategies for global cardiovascular risk approach by means of specific techniques of atherosclerosis measurement. It includes both strategies for diagnosis and follow-up. Using a software tool, Vascularis allows you to combine the benefits of total plaque area measurement technique described by Dr. David Spence and cardiovascular risk prediction defined by Dr. Michel Romanens. Total plaque area is the sum of the plaque area of all plaques seen between the clavicle and the angle of the jaw, measured by 2D ultrasound. Each plaque is measured in a longitudinal view, in the plane in which it is biggest. The perimeter of the plaque is traced with a cursor, and the cross-sectional area of that plaque is noted. Then each plaque seen is measured in the same way. The total of all the plaque areas is TPA. Assessing the burden of atherosclerosis is useful not only for risk stratification, but it is also for genetic research and for managing patients. Vascularis combines pretest results with TPA results through an algorithm developed by Dr. Michel Romanens. Commonly, scores like Framingham, Reynolds, EU score are used to evaluate vascular risk, which in turn measure out the presence or absence of specific risk factors. When adding the TPA data obtained, it is possible to estimate or adjust these score values. Therefore, more accurate results can be obtained considering a patient's atherosclerosis burden. A new approach to management of patients with vascular disease based on plaque measurement was implemented in 2003 in Canada and described in 2010 by Spence and Hackham. Vascularis is a program that allows any physician to make use of this strategy, thanks to technology and services developed to give support to the use of measurement of the atherosclerosis burden in clinical practice. Using a regular ultrasound and software designed according to Dr. David Spence's guidelines, the professional is able to record and report TPA measurements and obtain the adjusted cardiovascular risk. The Vascularis training program includes the theoretical background and the acquisition of technical skills required for total plaque area measurement, ultrasound technique, and use of IT tools. Through the implementation of central reading, a systematized protocol for quality control of all the studies are performed in the system. Professionals can request revisions of complex cases by the Spark team and Dr. Spence himself. The program also includes research activities for the development of new techniques for atherosclerosis assessment and the prevention and regression of plaque atherosclerosis. For example, 3D image analysis and composition of atherosclerotic plaque and vascular surface morphology. This is Vascularis. This is the most innovative and effective way to manage cardiovascular risk. For more information, please visit vascularis.com or ask for a meeting at info@vascularis.com.